Do you experience these itchy bumps in between your fingers? This is called dyshidrotic eczema. I am Dr. Martin Smith, a board-certified allergist and eczema specialist. Let's delve into this a little further. So these little bumps can be fluid-filled. They can occur in between the fingers, on top of the fingers, also on the palms and the soles of your feet. Episodes can last for weeks, months, or years on end, and after they heal, they frequently recur. Dyshidrotic eczema is more common in females and younger adults, and usually you can outgrow this condition as you get older. Causes are considered to be multifactorial, but are more common in people that have other forms of eczema, such as atopic dermatitis or seborrheic dermatitis. People that have contact dermatitis or contact allergies to metals such as nickel or cobalt are also more susceptible. Foods high in nickel include legumes, nuts, seeds, and even chocolate and oats. Foods high in cobalt also include oats, some nuts, and fish. People that work in the metalworking industry can also have contact dermatitis from the metalworking fluid coming into contact with their hands. Hyperhidrosis or excess sweating is associated with this. Also, smoking is a risk factor. And contrary to other forms of eczema, ultraviolet light exposure from the sun and things such as tanning beds could also make this worse. This can also be a side effect from treatment with certain medications, such as intravenous immunoglobulins or IgG, used in people with immune deficiencies. A drug used for psoriasis and psoriatic arthritis called Cosentyx can also cause this. So episodes usually start with intense itching, and then these little vesicles appear in between the fingers, on top of the fingers, on the palms, or the soles. But in 80% of the cases, only the hands are involved. Unlike other forms of eczema, this actually tends to be worse during the warmer months of the year. The little bumps or vesicles can last for weeks and usually end when the skin kind of peels off. Recurrent episodes can cause red, hard, cracked skin in between the fingers. So what can you do to treat this? Start by reducing skin irritation. You can do things such as washing your hands with gentle, non-fragranced, non-soap cleansers, and then moisturizing right afterwards with a thick cream containing ceramides and hyaluronic acid, or even regular Vaseline. Remember to use lukewarm water when washing your hands or bathing. When doing wet work like washing dishes or work that involves friction like gardening or carpenting, use wool gloves or non-latex gloves to protect your hands. Also, remove your rings, watches, and bracelets before doing wet work to avoid nickel exposure. Avoid other irritants coming into contact with your skin, such as laundry detergent, hair dye, or even acidic fruits such as lemons or limes. If these measures do not help, then it is time to go see your allergist or dermatologist. They would likely start with a topical cream containing a steroid such as clobetasol. They can also use a steroid alternative or a calcineurin inhibitor. An example is tacrolimus. If after 2 to 4 weeks these have not worked, they may give you an oral course of steroids to see if they can calm the symptoms. Next, there is actually a certain type of UV light that may be helpful called narrowband UVB light, and a dermatologist or allergist usually has this type of photo booth in their office. There are other systemic medications such as Dupixent or dupilumab that has shown some efficacy, and there are ongoing trials to investigate this. There is another drug called baricitinib or Olumiant, which is a JAK inhibitor, which has also shown promise in dyshidrotic eczema. In Europe, there is also a vitamin A derivative called alitretinoin that a doctor can prescribe, which has been shown to be helpful. Please let me know below if you have any other questions about this condition or what other videos you would like to see.